Have you ever stopped to think that the small act of brushing your teeth, something you do every morning and every night, could be one of the most powerful health decisions you make all day? It sounds dramatic, but it's a simple truth. The health of your mouth is a mirror, reflecting the health of your entire system. Many of us see our mouth as separate from the rest of our body, a place just for eating, talking, smiling. We might worry about a cavity or bad breath, but the real story is much deeper and more serious. What happens inside your mouth does not stay there, and ignoring it could have consequences far beyond a simple toothache. Imagine this for a moment. Your mouth is a bustling ecosystem, home to billions of tiny organisms or germs. Most are harmless, but some are not. When your oral hygiene isn't what it should be, these harmful germs can multiply out of control. They can cause infections in your gums, making them red, swollen, prone to bleeding. You might think a little blood when you brush is normal, but it's not. It's a sign that the protective barrier of your gums has been broken. This small opening is like an unlocked door, giving those harmful germs a direct pathway into the rest of your body, and that is where the real trouble begins. This isn't meant to scare you without reason, but to empower you with knowledge. Think of it like this. If you knew a loose wire in your house could potentially cause a fire, you would fix it immediately. The same logic applies to your oral health. A problem in your mouth, like persistent gum disease, is a warning sign. It's a signal that something is amiss that could impact your heart, your lungs, and even your risk for developing certain types of chronic diseases. Understanding this connection is the first, most crucial step toward taking control of your long-term well-being and protecting yourself from preventable harm. The good news is that you hold the power to change this story. The toothbrush in your bathroom, the floss in your cabinet, and the choices you make every day are your best tools. This isn't about complex medical procedures or expensive treatments. It's about simple, consistent habits. By dedicating just a few minutes each day to caring for your mouth, you are doing more than just preventing cavities. You are actively building a defense system for your entire body, a shield against illnesses that can quietly take root when we are not paying attention. Your smile is more than just an expression. It's a vital sign. Let's trace the path of these microscopic invaders. It all starts with plaque, that sticky, colorless film that constantly forms on your teeth. If you don't remove it by brushing and flossing, it hardens into tartar, which can only be removed by a dental professional. This buildup irritates the gums, causing a condition called gingivitis, the earliest stage of gum disease. Your gums become inflamed, red, tender, and likely to bleed. This inflammation is your body's natural response to attack, a sign that your immune system is fighting an infection. When your gums are inflamed and bleeding, they become porous. This creates tiny sores and openings in the delicate tissue. These openings are the entry point. The harmful bacteria living in the plaque and tartar can easily slip past this weakened defense and enter your bloodstream. Once they are in your blood, they can travel anywhere your blood flows, which is essentially every single part of your body. They become unwelcome passengers on a superhighway, capable of reaching vital organs like your heart, your brain, and your lungs in a matter of minutes. This process happens silently, without you feeling a thing. Once these bacteria are circulating throughout your body, they trigger a wider immune response. Your body recognizes them as foreign invaders and ramps up its defenses. This leads to a state of chronic, low-grade inflammation. Think of it as a small, slow-burning fire that never quite goes out. While acute inflammation is a healthy and necessary response to injury, this persistent body-wide inflammation is damaging. Over months and years, this constant state of alert can wear down your body's systems, damage tissues and blood vessels, and contribute to the development of a host of serious, life-altering diseases. This is why a dentist might ask you about your heart health, or a cardiologist might ask about your last dental visit. They understand the body is a deeply interconnected system. The fire that starts in your gums can spread, with consequences far more significant than most people realize. One of the most well-documented and frightening links is between gum disease and heart disease. The chronic inflammation caused by oral bacteria can have a direct impact on your cardiovascular system. This inflammation can contribute to the hardening and narrowing of your arteries, atherosclerosis. It can also make plaque inside your blood vessels more unstable and likely to rupture, which can form a clot. If that clot blocks blood flow to the heart, it causes a heart attack. If it blocks blood flow to the brain, it can cause a stroke. The evidence is so strong that many cardiologists consider oral health a significant risk factor for heart disease. The connection with diabetes is a dangerous two-way street. People with diabetes are more susceptible to infections, including gum disease, because high blood sugar can weaken the body's defenses. Conversely, a serious gum infection can make it much more difficult to control your blood sugar levels. Inflammation from the oral infection can reduce your body's sensitivity to insulin, the hormone that regulates blood sugar. This creates a vicious cycle where gum disease makes diabetes worse and uncontrolled diabetes makes gum disease worse, increasing risk for serious complications over time. Your respiratory system is also at risk. The mouth is the gateway to the lungs. You can breathe in bacteria from infected teeth and gums directly into your lower respiratory tract. For most healthy people, the body can fight this off. But for older adults, for individuals with weakened immune systems, for people with pre-existing lung conditions like COPD, these bacteria can cause serious infections, pneumonia, acute bronchitis, and other respiratory illnesses. Furthermore, a mother's oral health can affect her unborn child, raising the risk of preterm delivery and low birth weight. Dental care is essential prenatal care. When we talk about the most serious consequences of poor oral health, we must include the link to cancer. While it may seem surprising, research is uncovering a troubling association between chronic gum disease and higher cancer risk. The most obvious is, of course, oral cancers, throat cancers. Chronic irritation and inflammation, especially with smoking and heavy alcohol, can create conditions where cancerous cells are more likely to develop. Regular dental checkups are critical for catching these cancers early. Studies link poor oral hygiene to a higher risk of pancreatic cancer, one of the deadliest cancers. Scientists are still investigating mechanisms, and there are two leading theories. First, harmful mouth bacteria can travel to the pancreas, triggering inflammation that may help cancer develop. Second, inflammatory byproducts from the mouth enter the bloodstream and promote cancer growth elsewhere. This is about risk, not certainty. Gum disease does not mean you will get cancer, but it appears to be one factor that can tip the scales. Chronic inflammation is a key suspect. It can damage DNA and encourage faster cell division, raising mutation risk. So, reducing chronic inflammation, including from an unhealthy mouth, is a proactive step to lower overall cancer risk. The takeaway: don't live in fear. Act with awareness. If you've been ignoring oral health, and especially if you smoke or drink heavily, you're compounding your risks. Your body is excellent at sending you warning signs, and your mouth is no exception. You just have to know what to look and listen for. One of the earliest and most common signs is bleeding gums. If you see pink or red in the sink, do not ignore it. Healthy gums do not bleed. Red, swollen, or tender gums are not from brushing too hard. They signal infection that needs attention. Persistent bad breath is another powerful indicator. Chronic odor often comes from bacteria below the gum line and on your tongue, a sign the ecosystem is out of balance. Covering it up is like turning off a smoke alarm without checking for a fire. Fix the root cause. As gum disease progresses, you may feel pain when chewing. Gums can recede, making teeth appear longer and creating pockets where bacteria thrive. Advanced infection can damage bone and loosen teeth, a dental emergency in adults. Watch for sores, lumps, or rough patches that don't heal in 2 weeks, or white, red, or speckled patches. Many are harmless, but some are early signs of oral cancer. Early detection is critical. If something feels off, book an appointment right away. The good news: taking control is straightforward and within reach. Brush twice a day. Not a quick 30 seconds, but a dedicated 2 minutes each time. Use soft bristles and fluoride toothpaste. Be methodical. Outer surfaces, inner surfaces. Chewing surfaces. This is your first line of defense against plaque. Floss daily. Brushes can't clean tight spaces or under the gum line. Flossing removes hidden plaque and disrupts bacterial colonies before they inflame your gums. Gently clean your tongue to reduce bad breath bacteria. Cut sugary drinks and snacks. Bacteria feed on sugar. If you smoke, stop. Reduce alcohol. Both drive gum disease and oral cancers. See your dentist regularly, typically every 6 months. Professional cleanings remove hardened tartar you can't at home. Exams catch cavities, gum disease, and signs of oral cancer early. Be open about conditions like diabetes and medications. Think of your dentist as a vital partner on your healthcare team. It's important to view oral care not as a chore, but as an investment in your future self. It's a commitment that pays dividends for a lifetime. Teach children from the first tooth. Make brushing fun and consistent. Habits that last. Kids who learn early have less pain, miss less school, and grow confidence. As we age, adapt. Electric brushes for mobility. Hydrate for dry mouth. Clean dentures daily. Caregivers can help and keep appointments on track. A toothbrush, floss, and checkups cost little compared to advanced gum disease, heart disease, diabetes complications, or cancer. Treat your mouth as the gateway to your body. Be proactive, not reactive. Remember, tiny germs can travel and spark silent inflammation, but you can stop them. It starts tonight. Brush for 2 minutes. Use your floss. Look at your gums. Make that appointment you've been putting off.